All right, everybody, welcome back for another deep dive.
Yeah.
Today, we're tackling something that's really important to a lot of people.
Yeah, for sure.
We're talking about diabetes prevention.
Huge topic.
Absolutely. And, we always try to bring you guys the best information. And we found this really interesting video by animated diabetes patient.
Okay. Yeah.
And we're going to kind of go through some of the points that were made in there and talk about them and kind of our takeaways from that.
Sounds good.
So one of the first things that the video talked about was, there's some things about our risk of developing diabetes that we just can't change.
Yeah.
And that kind of bummed me out a little bit at first because it's like, oh man, like age, I'm getting older every day.
Right.
And then ethnicity, that's another one. Like those are two things that are just, we can't
You can't change them.
change those.
Yeah, they're non-modifiable risk factors.
Right, exactly.
You inherit those.
Yeah. So tell me a little bit about that. Like why are those risk factors and why can't we change them?
Well, I think it's important to remember that it doesn't mean you're doomed if you have those risk factors.
Right.
It just means that, you have to be a little bit more aware of it and you have to focus on the things that you can change.
Okay.
So, for example, different ethnicities have varying predispositions to insulin resistance, which is a key factor in diabetes.
Okay.
And then also, as we age, our bodies just naturally become less efficient at using insulin.
Oh, that's interesting. So it's really about like how our bodies actually function.
Exactly.
Yeah. Okay. Well, I'm glad that, it's not all doom and gloom just because, I'm getting older and I can't change my ethnicity.
Right.
But, what I thought was really cool was the video then went on to talk about things that we can change.
Yes.
Like what they called modifiable risk factors.
Yes. These are things within your control.
Yeah, within our control. I love that.
Yes.
So it's like, okay, I can't change those first two things.
Right.
But I can change some other things. And those other things are like what reaching and maintaining a healthy weight.
Yes.
Eating a balanced diet.
Yeah.
I hear that all the time, but we'll dive into that a little bit more.
Sure.
Getting regular exercise.
Yes.
Living a healthy lifestyle. Okay, that's kind of broad, but we'll get into that.
Right.
Getting adequate sleep. This one surprised me. I was like, really, sleep can impact my risk of developing diabetes?
It can.
Wow, okay.
Sleep is so important.
Yeah, and then managing depression.
Yeah.
So it's like, wow, this is really interesting. It's like the way I live my life, these everyday choices I make can really impact my risk.
Yeah, mental health is important for physical health.
Yeah, I like that. And what really blew my mind was that the video said that, that studies have shown that diet, exercise, and lifestyle changes are like the most impactful things that we can do to lower our risk.
Absolutely.
And they even said that it was like more impactful than like other interventions.
It's true. The research really backs it up. Yeah, there was a study that was done that showed that people who make significant lifestyle changes are like way less likely to develop type 2 diabetes.
What percentage are we talking about here?
It's like 58% less likely.
58%.
Yeah.
Wow. Okay, so that's huge.
That's huge. It's really empowering.
Yeah, it's empowering. It's like, okay, it's in my hand.
Yeah.
So, I hear these terms all the time: balanced diet, healthy lifestyle.
Yeah.
But I was hoping you could maybe break those down for us a little bit.
Sure.
Like, give us some specifics.
So when we talk about balanced diet, we're talking about like focusing on whole unprocessed foods.
Okay.
So that's going to be your fruits and your vegetables, lean proteins,
Okay.
whole grains.
So like I'm picturing like an apple and a chicken breast and like some brown rice.
Yeah,
Is that
exactly.
okay?
Like a nice salad.
Okay.
Things like that.
So what's wrong with processed foods then?
Well, processed foods are often stripped of their natural nutrients,
Oh.
and they're loaded with added sugars, unhealthy fats, and preservatives.
Yeah.
And all those things can really increase your risk of developing diabetes.
Okay, so like I'm thinking chips, cookies.
Exactly. Yeah. All that stuff.
Okay, so swapping those out for, like you said, an apple or some nuts or something like that could make a big difference.
Huge difference.
Okay.
Yeah.
And then what about a healthy lifestyle? Like what does that even mean?
Yeah, it doesn't have to be this like crazy thing.
Right.
It's just incorporating, little things into your day that can make a big difference.
All right.
So, going for a walk a few times a week, like a brisk walk.
Yeah.
For 30 minutes.
Okay.
Finding ways to manage your stress,
Yeah.
like maybe yoga or meditation.
Okay.
And then also prioritizing sleep, like getting those 7 to 8 hours of sleep a night.
Okay, so these are all things that I can do.
Yes.
That are pretty easy to, implement into my life.
Absolutely.
Yeah, I like that.
Oh.
Okay, so this is all great information, but why is everyone talking about diabetes prevention? Like, what's the big deal?
Well, I think it's a big deal because the number of people with diabetes has just skyrocketed in recent years.
Really?
It's a global health crisis.
Wow.
It has huge implications for, healthcare systems, economies.
Yeah, that makes sense.
And it doesn't just affect the individual, right? It affects families,
Yeah.
communities.
So knowing about these risk factors and stuff can help people catch it early and like be proactive.
Exactly. Knowledge is power.
Yeah.
If you know your risk factors, you can work with your doctor to create a plan
Right.
to lower your risk. And, early detection is key.
So it's really like all about taking control.
Yes. Taking charge of your health.
Awesome.
Yeah.
So to kind of sum things up, it sounds like we've learned that while we can't control everything about our risk of developing diabetes,
All right.
we can make impactful lifestyle choices to really reduce our risk.
Absolutely. But I think it's also important to remember that we've been focusing on individual prevention.
Yeah.
But there's also this bigger picture.
Oh, yeah.
Things like access to healthy food.
Affordable healthcare.
Yes.
Safe environments for exercise.
These are all things that, I don't really have control over, as an individual.
Right. It's about the systems that we live in.
Yeah, that's a really good point. So it's I can make these healthy choices.
Right.
But if I don't have access to healthy food, if I don't live in a safe neighborhood, it makes it a lot harder.
Exactly.
Yeah, that's a great point.
So it's a complex issue.
Yeah, it is.
Yeah.
Wow, this has been a really great deep dive.
Yeah, it has.
I feel like I've learned a lot.
That's good.
And thanks for breaking it all down for us.
You're welcome.
And to everyone listening, remember that even small changes can make a big impact.
Yes.
So keep learning, stay curious, and take charge of your health.
Absolutely.
Thanks for joining us.
Thanks for having me.
See you next time.
See ya.
Bye.